In the history, unfortunately, big changes often follow big crises. If we had a crisis where somebody lost a tape containing some confidential patient information, this is quite a number of years ago, and this was in the context of us already being under pressure because we'd had some difficulties with information governance and so on, and this really was almost like the final straw, and it was quite clear to everyone that we couldn't allow this to happen again. So what we needed was a wholesale change in the way we handled, well, certainly recorded clinical data and dictation more generally. So the obvious thing to do was to move from an old-fashioned tape-based system to something, well, even then was seen as pretty revolutionary, being fully electronic. So we're using the standard BigHand offering, which is an electronic transcription system. So the clinicians, usually doctors, but not always, will use one or other of a few different devices. It might be a mobile phone, or it might be a USB microphone, or it might be a dictation machine, just to record their letters or any other clinical information they like, as per usual. And then it's submitted electronically to their secretary, or rather into a work list, which their secretary will access, but which can also be shared between other admin staff. The secretaries then type the letter in the traditional way, as it happens, and then it goes back via one of our other systems to the clinician for checking and sign off. I mean, in the short term, there's obvious things, like the quality of the recordings was dramatically better because we were using old worn-out machines and old worn-out tapes. Sometimes they would get stuck, or the recording would be distorted, or you couldn't hear it. So all of that changed immediately, and suddenly you had very good quality recordings that could easily be listened to and transcribed. Then you had the speed, so the minute that the recording was finished on the device, wherever the clinician was, it would immediately appear on the secretary's work list. And then also there's the ability to reallocate work. So secretaries, for example, could very easily move jobs between themselves if someone was off sick or if someone had a bit of spare capacity. It's been interesting to work with them over the time, actually, because we've gone from it, I think they've grown quite a lot themselves over the 8 or 9 years we've been dealing with them. They've been available, they've had some good ideas about what to do, and they've given us some good advice so far. I'm also keen to kind of almost rediscover what the product can do, because we've got used to it doing one thing, and then in the interim, an awful lot has happened that we're not really up to date with. So I'm excited to see what we can do with what they now have.